Welcome, Dr. Krishnan, fondly called SRK. Glad to have you here at my podcast, and it's been an amazing journey. I came to you as a kid back in 2006, and at this point of time, doing a podcast with you is definitely going to be an amazing experience. So, welcome again.
My pleasure, Shivashish. It's been a wonderful experience right now. But you're also making me feel that I'm too old for you. Hope this day is more memorable for me.
100%, 100%. So, how the journey has been for you? I think over more than 2 decades.
Yeah, I'm running it for more than 2 decades, and I started my practice in a very small area in Pushwakam. Right now, I'm in my own premises.
Yeah.
So all like kids like you coming into.
I think I've seen you growing from a very small space to the space that you have now. And as I age, even the clinic has aged.
Yeah,
So,
I'm so happy. I'm very glad to be here. My pleasure.
yes. My first question, it's always been talk of the town among the doctors, and few of my friends who are doctors too, that why other doctors don't consider dentists as doctors. What is this internal rivalry that keeps going, since decades?
See, basically, the dentists are one who treat the tooth. Other doctors think we treat only the tooth. Okay, when we treat the tooth, we always see other parts of the body as well. But they don't consider us. They always consider as one stylish people, running around checking only the tooth. There is a department in dentistry, we call it as oral and maxillofacial surgery, which treat trauma as well. So the aggregation given by the doctors at whether dentists to be called as doctors or not is up to them. But we proudly say that we are dentists. I love to be dentist. Even in railway station, I give my name as Dr. Krishnan, so that in emergency we could try to help them in case of cryos. So that's how it goes. So I'm not bothered other doctors considering us as doctors or a dentist. But for us, we love to be a dentist.
Well, honestly saying, as somebody from a very layman's perspective, dentistry has evolved, to a next level. Today, we have something wrong with the tooth, we can immediately get it replaced. So I don't see that happening in other parts of the body. So I believe dentistry, the way it has evolved, no other, other part of medical field has evolved that much.
The whole credit goes to the food industry. They started to develop the food industry so much, so the tooth is into constant use. So obviously, when they eat so much, then dent is in demand. So I should thank the food industry for giving us so much of business.
How do you see dentistry being involved from the time that you were into your college days and now? How tough it has become or how easy it has become? How do you see this?
Yeah, when I finished my college, when I started my practice, the dentistry was all about pain. Oh, it's all about pain. They'll come with the pain, they want to get that treated. Now the dentistry is moving into a cosmetic area where I'm seeing people coming up for a smile design. They want to get their tooth look good. They come for whitening. They come for a total tooth care as well. I will not say patient is not, awareness have improved with decades, but negligence also have improved in the same way. So they are aware that when they have a chocolate, they'll get into a decay. And still they have. And the negligence is that they know that it's going to get into decay. So doctors are always there. So both ways, we are benefited.
Correct. So I've observed this pattern in the last few years, not just in Chennai, but otherwise in other cities and other states also. The number of dentists that has grown, now we used to have one dentist in one area at one point of time. Today, every street has got a dentist. Like how other business work, that is how a dental clinic is coming across India and other places also. What is your opinion on this? How do you survive? At the end of the day, running a clinic is also like running a business, keeping apart the medical practice and everything. But when there are two clinics existing in the same area, uh, how do you see this as a doctor who is supposed to only treat patients, but also now focusing on the business part of it?
Now, I'm correcting you. There is 4 dentists in one street.
Okay.
It is not 2. It has become 4 right now. See, the practice makes you progress. What type of a practice are you doing in your practice? You will have those type of patients coming up. So that in my personal opinion, when you learn for growing, then you will update yourself with something new in dentistry, and patient will drop in for that. So I don't feel any competition even if I'm being one among the 4. I have my specialty practice running and people drop in for that. So people who learn things and do the same thing again and again, yes, there is a competition which is running around. So people who say, okay, if I'm doing a treatment, then the cost is this much. Then the other dentist will see, okay, I'll do this treatment for this much cost. So it is not that way which I are practicing, but currently practice is going on that way. So if I work on the specialty basis, know the need of the patients and work on it, then the
Things are
competition
really
for me,
different, yeah.
competition is nowhere there. So you're in your own land.
Right. So it depends on how individually a dentist see himself or herself growing.
Exactly. So it is not only that, how beautifully you conduct your clinic, and the business wise also. So it's not about giving a smile design for all patient. You should know where to say no. And if you know to say that, then again, it is a big deal that you can run your practice in a more successful way. And I'm one among the group which is practicing in that way.
Yes, and I have been the witness of it. Lately, because of all this social media and growth of digital media, a lot of dentists are coming up on these platforms and promoting the clinic, promoting the dentistry as such, promoting the services. I have seen a lot of people focusing, a lot of doctors focusing more on the ambience. For example, if it's a kids ka section, then they have ambience accordingly done, which they promote. If it's a section for the elder people, then the ambience is accordingly. Somewhere I feel that the what is required to be promoted, that is missing out. For example, not much is being spoken about oral health, and if it is also spoken, it's very technical that people who are seeing online do get bored, and you're somebody, for a long time you have kept yourself away from it. What is your thought process on that?
See, ambience is one thing which is very important. I will not say no to the ambience. Patient, if they had to drop into your clinic, the ambience has to be good. If it is unclean, untidy, you cannot expect patients to drop in. So ambience makes sense. But after ambience is what you practice makes more sense. So if I want to give something to the patient, if I think the patient requirement is met, then that clinic is going to grow automatically. So patient's oral health, one thing is like I earlier spoke, patient is aware about everything. Patient actually don't require any knowledge because there is umpty number of knowledge in the Google where patient is aware about. Their negligence is the key. So they don't want to know is my concern. They don't want to have a big knowledge. I'll say my patient do a night brushing and I need a tool which will go and hit them do night brushing. That is mom or their dad or their sister. But that tool is not happening. So they know that night brushing is the cause for the problem, but they will not do it. So they will be coming in search for the dentist. When they search for the dentist, the first search will be the ambience. You cannot deny that. The ambience is very good. And plus, once they enter, if the doctor doesn't give the oral health properly, the patient is going to move to the next dentist. So, in a way, that dentists are giving a good oral health is up to the patient who takes it properly.
Rightly said.
So, there are few dentists exception, but dentists want to really try to help the patients. There is no dentist they want to just do the work and send them off.
Rightly said.
We want to give them as much knowledge as possible to send them to make sure that they don't come with the same problem again. But again, I'm saying a big credit to the food industry. So they come with varieties of foods. So they try all this and
So the
and get
dentistry has groomed
grown with the
in
food
terms of
industry.
revenue and
Yeah,
everything.
exactly.
Earlier in the 90s or before that, you know, we used to just get one type of toothbrush, one type of toothpaste. The transcendence was not that great, you know. It was considered as a very low key thing that you just go to a shop nearby and used to get a toothbrush and paste and just finish off your oral hygiene. Over a period of time, the entire industry has groomed into more into very fashionable, you know. The products have come up in such way that the packaging is very catchy, very attractive. So when you go to a supermarket, you tend to buy based on the packaging without even considering whether it is good or not. Even in toothbrushes, we have different segments now. We have hard brush, soft brush, then we have automatic, if I'm getting the word right, sorry. So there are lot of options that are available for, you know, people to choose from. But I don't think in today's scenario anybody is looking out for, you know, or buying something from an oral hygiene perspective. They're just going with what suits the best for them, or okay, this is something fancy, let me try it. Is this a genuine way to look at it? Is this how the industry who are manufacturing, you know, toothbrush and toothpaste should look forward, or you know, we are getting it wrong completely, and we need to change the methodology with the way we buy things?
See, basically, the toothpaste is promoted via ad. None of the public will go and want to buy whatever they want. Few wants to see, okay, if I look at that, there is one ad saying suddenly there was a tooth sensitivity, and they shout at it, and they'll bring a paste, and they promote a paste and saying that sensitivity is gone, and the doctors are promoting it. My concern is like, why that sensitivity happened, nobody knows, and how could be the paste going to be a solution for it? So I'm little confused when I see the ad. Okay, so is it so? And when I see another ad, I see patients, the ad saying that, do you want salt in the paste? And next I've seen, in future they might ask garam masala, some masalas they want in the paste. And this is all this marketing tool. For me, you buy the best of product in the market and then you don't do night brushing. Doesn't make sense. So it is all about brushing, not the brush or the paste. There are brushes which is good and suited for the tooth, and it depends if it requires to be changed. If the patient is using their regular normal brush which is serving them better, let them continue with the same brush. For me, there is no whitening toothpaste which is going to help in any ways. The visible white, I know my patient today. I've seen a senior most doctor. He's saying that I'm using a whitening toothpaste for the past 2 years and the color is the same. I told it's nothing is going to change. So you can use it. Paste is just a lubricant between the tooth and a brush. You apply it, you place it, and it'll make your tooth fresh. So there is no calculus or dirt which is happening inside your mouth. So paste is a lubricant, and brush is a tool for you to clean the tooth. So make sure that, see, it could be a raw example. Even if you want to clean your toilet, okay, you use your brush and you don't see any brands in it.
Correct.
So what you do is like you need to clean it well to make that bacteria free. The same suits for the tooth also.
So whether we use any sort of flavors in it, or whether we don't, or whether we just go with standard, doesn't matter. What matters is how well you brush.
Yeah, brushing is the only thing which you can go ahead with. Without brushing, whatever paste or whatever modernized equipment which you have inside your mouth for brushing is not going to be useful at all. So I know people who started to use neem right now. So if anything, if you can get continuously and constantly, I would prefer yes. So if something is useful for you, until if it is kept clean, sterilized, and it is good to use inside your mouth, then it is well and good. For me, brushing makes a big key. For few gum inflammation, for gum related problems, I have prescribed few paste. So it's all based on individual things, not patients going and getting, it's all fancy products. At the end, what are you going to get is you have just brushed. That's it. The paste is not going to change the color of your tooth. The paste is not going to change the flavor of the tooth. Immediately after an hour, when you start eating, it is going to take the smell of the food which you are going to take.
Correct.
So paste or a brush is not going to make any sense. Brushing is making more sense to keep your tooth
So even
clean.
the type of bristles doesn't matter, whether it is hard or soft. Nothing of that sort
No,
matters.
I prefer a medium bristle ones,
Okay.
and now I started to prescribe more of an motor brush. So, and because of the pressure people using it, when they use a normal brush, I'm seeing another 5 days or 6 days the flares is flaring up. The bristles are flaring up. With motor brush, I'm seeing good result that it is cleaning on its own without any pressure of the patient. So, technically, I'm happy with the motor brush.
Right. One of the key points which I also wanted to discuss, which you had just brought it up, is about the sensitivity. Uh, as far as the common man is concerned, they are in the understanding that if you're going to use a toothpaste which is focused on sensitivity, the sensitivity goes off.
Yeah.
A lot of us don't know whether it cures the symptom or whether it actually cures the sensitivity. And people believe that just by using toothpaste, you're onto it. So, what is your opinion on it? Is the problem is deep rooted, or it is just that if you use that particular toothpaste, you're sorted?
Let me explain you with my patient. Okay, there is a patient of mine who had a sensitivity who he couldn't eat ice cream at all for the past 10 years. He went to a dentist and the dentist told you have to live with it. So, and the tooth had got so much of abrasions. And it could be because of various other reasons, even if it is a reflex of his stomach or hard brushing or any acidic products, anything can give him abrasion. So what I technically do is like when patient drops in with that type of sensitive issue, first thing is like I'll see the tooth condition. If the tooth condition demands treatment, then the treatment is the best choice. And then the desensitizing toothpaste. Then comes the desensitizing toothpaste. The paste alone cannot do wonders at any cost.
So, just by randomly going with the advertisement which says that sensitivity gets cured by toothpaste is a hoax.
It will give you a temporary relief.
Okay.
It will definitely give you a temporary relief. But predictable result is only where doing the treatment.
Doing the treatment.
Plus, the paste will really help.
There's one product which has come in the market, and in fact, I also in my work I promoted that product for a very famous brand. So toothpaste may take few days to heal the sensitivity part. There comes the spray or a paste. The moment you feel sensitivity, you just apply and vanishes. Do you think this is making sense?
See, for me, nothing makes sense. Basically, when I see the patient, when they say sensitivity, they need to approach the doctor. No question about it. If it has to be treated in clinic and the sensitivity goes like this, it goes off in a flash.
Right.
What if there is a deep-rooted lesion and you keep applying the spray?
Then it's a problem.
Then it becomes a problem. So you don't know. See, the sprays all will give you temporary relief. There is a grandmother's medicine of keeping a claw when there is a pain. It's similar to that. Okay, you might feel temporary relief. At the end, you had to go visit the dentist. So instead of progressing or delaying the time to take you to the dentist later, instead come to the dentist faster so that you could solve the problem at the earlier stages.
This is something which is very new for the audience who's going to hear it, because it's so randomly they just go and watch the advertisements and just go buy that product. So this is a very new piece of information which the audience are going to get today.
No, Shiva, I'm not against any product.
Yeah, I do get that.
I'm against the usage of the product.
Correct.
In the sense where it has to be used, let the dentist decide. You going into the market straight and buying it, and any dentist is always against it.
Lot of toothpaste today is being sold. For example, we have, like you said, advanced whitening. We have salt. We have based on taste. You know, Uh, like we also have few toothpaste which is based on the flavor of bubble gum
Yeah.
and charcoal,
Yeah.
different things. So at the end of the day, you believe that it's all for the sake of marketing, but at the end of the day, the products are same. The treatment is same. Everything is same. So it doesn't matter whether you use A toothpaste or B toothpaste, or does it matter that when they commit to you saying that advanced whitening toothpaste, it actually happens maybe over a period of time, not immediately.
No, anything post treatment. See, if the patient requires a whitening to be done inside his mouth, the paste is going to help post whitening session in the clinic. If the problem is in the gums, there is a paste we give to the patient after cleaning. So the paste is an adjuvant. It is not the treatment. And at any cost, paste is never a treatment.
Pace is never a treatment. Right. In today's time, the last 2 3 years, the awareness about the ingredients in toothpaste has also grown among people. So this SLS, sodium lauryl sulfate, for a time it became a talk of the town among all the common men. A lot of people have their own opinions on it. Doctors also have their own opinions, but the overall summary that has come out is the fact that it is not really good for the oral health. Plus, it is a cancer-causing agent. So my first question is, if it was such a harmful ingredient, how did the medical body promote, allowed or maybe gave permission to it? And there are a couple of startups also which are manufacturing toothpaste on the basis of this particular ingredient not being there in their product. So we have monopoly of toothpaste brands, which are using this, and they have also maintained some numb over this issue. As a dentist, and what is your opinion on this particular ingredient that's being added in the toothpaste?
See, there are many ingredients within the toothpaste. As you told the answer as well. The medical council or the dental council is not going to promote something which is harmful. So they are going to suggest us what is good for us. So which technically means sodium lauryl sulfate is not a big problem. So even if it is there, we are going to have a paste in the brush is only this much. So the usage of the paste itself is very less. It is definitely not going to harm your teeth at any point of time. At any point of time, when you use the toothpaste with this fear that having something carcinogenic inside the mouth, and that fear is going to be bad for you. Instead, just go ahead with the brushing paste, and the ingredients of sodium lauryl sulfate in a minimal level is definitely not a concern. If it is a big concern, definitely dental council or the medical council will take them to the court. This is definitely not a problem as far as the paste ingredients is concerned.
The debate was, it is not about the quantity that we are using on daily basis, but about the fact that slowly it's building up. Like you said, it's a very small quantity that we use, but we are using it for years.
Yeah.
That damages the oral hygiene is what was being projected.
No, technically a paste usage and the sodium lauryl sulfates inside it, it kills the bacteria, it increases the foam in our brushing. For us, there are many, even in other products like shampoos, soaps, these lauryl sulfates are constantly into the talk. When you have this products, certain products which is constantly spoken, and there are always a two sector of people which they say it is not a problem and it is a problem. So what am I considered is like, I've never seen a patient who got this effect brushing for a longer time, and due to that I've treated that. So in 20 years of experience, I've seen people using it, all kinds of paste in the world, and I've seen people coming up with no problem regarding with the paste. But I've seen people eating so many things, within 2 months I've seen them coming with a trouble. So once again, we give so much of stress on the
Ingredient, but not the
ingredients,
food pattern.
but the food pattern. So I always consider paste and a brush is too secondary compared to brushing. Without fear, you can brush with the paste recommended by the dentist.
That's a really good information because a lot of people were in dilemma that all these toothpaste are only trying to promote their own brand, not looking forward to the oral part. But I think this a sensible answer will clear a lot of doubts in minds of people. When it comes to kids, do you see the growth of bad oral hygiene among kids than before and then? I mean, before versus now. Do you see the kids visiting your clinic has increased over a period of time, or it has decreased, or it is just going the same way it is?
Right now, I will not say kids don't take chocolates on their own and eat. Basically, it is all about their parents and the parenting. So if the kids coming for a dental visit, and I've seen parents complaining that my son or a daughter is eating so many chocolates, and I will ask, my first question is always, who's buying the chocolates? Is your son and daughter taking money, going to the shop, buying it, or it is there in the fridge? So the constant parenting style is, they think it is improved, but it is actually damaging the oral cavity of the kids. The suffering is all with the kids. They come with pain, and we need to do a treatment based on it. We have done treatment under general anesthesia at the age of when the patient is age 3 or 4 years, then you cannot do treatment in chair. This is always in hospital under general anesthesia. Then if at all, if I had to do a treatment, it's always a trauma for the kids. So understanding, I cannot put the entire blame on the kids. Kids are much more sensible. If you teach them, they follow. The problem is, it depends on what you teach. If you teach about, okay, fine, we'll buy chocolates, okay, enjoyment is always eating chocolates, then the kids are going to have chocolates and then come back. If you teach them they deserve chocolates by doing something good, then the chocolate quantity of eating will be very, very less. So it's all about parenting, nothing about the kids. They are coming with the problem more. It's not because of the kids. It's all about the parents, where they give chocolates without considering. But when problem comes, the blame is only on the kids.
Kids. What is your take on few hacks, if I have to ask you, concerning kids and their oral hygiene as a parent? What are the few hacks that one has to keep in mind or one can implement it for a betterment of oral hygiene concerning kids?
See, basically, the kids are very smart. Nowadays, kids started to see reels above the age of 6 or 7. They started to see the reels as well. So promote them with a proper disciplined approach of handling their health care. For that, the parents has to know what is health care, the disciplined way. If their parents do the night brushing, kids will follow. If the parents gargle their mouth after having food, kids will follow. If the parents don't do it, kids can never follow. So it all depends on the parents who's the first teacher for them. So they had to grow better to make the kids come in their way. So brushing, making, if at all, if the kid wants to keep their oral health clean, night brushing is the only key. And a morning brushing. First thing in the morning and last thing in the night, if they do a brushing and gargle after everything. I'm not asking the kids or not to eat chocolates at all. Make sure that they deserve chocolates. Okay, make sure they do something good to earn the chocolates. And after 6 o'clock, avoid chocolates.
Right.
So these are all the ways where they can keep their oral health very, very clean. So instead, you ask, we think a good parenting is giving everything. I would always say, saying no is the biggest quality of a parent. So if you could say that properly, then the kids' oral health will automatically improve.
Be clean. The braces part, as a lot of people today, even when I was in my school, a lot of people used to wear those braces, students also. Can you tell me how does it happen and why it grows that way, that we need to put a brace to bring the alignment proper?
If I talk about brackets, the treatment goes for various reasons. if there is a space between the tooth, if the tooth is crowded, if it is not aligned properly. So there are various where the tooth is so proclined. For everything, the braces are the key. So it basically happens when the jaw growth is minimal and the tooth growth faster, or the middle teeth shedding out late and the permanent teeth coming out later. So the biological age of the tooth is not matching with the growth of the patient. So when that happens, the tooth goes into a malalignment and that would be a space. So for all those causes, we go into a treatment called brackets. This is the only solution at this point. But right now, I'm seeing the jaw size of the kids and the age of the patient, height of the patient is not matching much. So it also based on the lifestyle of the patient which is happening, or genetically the growth of the patient is slow. So I'm seeing multiple reasons for getting into this trouble, and we solve it only via brackets.
A lot of people are not confident of putting those braces because it is visible and it may spoil their personality. So there is a lot of confidence issues that goes into it. So they're not very comfortable doing it. More than the negligence out here, the concern is about how others are going to look at you, right? So today we have lot of visible braces and all these things. What is your suggestion that if somebody has this issue where nothing is aligned well, what is the first line of treatment that one should take up at a teenage or maybe at a very young age if they find this issue?
See, when there is a malalignment where I need to correct the alignment both for a functional and a cosmetic purpose, there are two ways to treat it. One is the bracket, which has been practiced for years together. And these brackets are little difficult to handle because it is permanently fixed. Your eating is little compromised. You had to keep that area clean, and your maintenance should be very, very, very good. The very important thing is like there is always a pain and pressure. There will be a poking a little with the brackets, and in doing so, thinking about that, the researchers have come out with something called as aligners. This aligners has made things very easy in all treatments. Wherever brackets was made very difficult, the aligners are little comfortable right now. The talk of the town in dentistry is only aligners. Everyone is selling aligners right now, and the aligners are going good as well. And the patients are very comfortable wearing it, and the result is also up to the mark. Again, they could eat whatever they want, so they can remove it whenever they want it. So, and the treatment is also painless. So, why not? Aligners makes a good choice for the people right now.
And how costly it is or how affordable it is in today's time? Can a middle income family or lower middle income family afford that?
See, there are aligners are generally costlier. Right now in India, the aligners are pretty costlier. There are branded US based aligners also there, and that is too costlier. I don't it's like the middle class affording, it's up to them to decide. It is pretty costlier. So brackets are always there. The result is always the one. You know, you get the result. You don't get a best of result with aligners or with the brackets. Both ways, the result is the same. It's whether you go with a Benz car or a Honda City, the destination is always the same.
Correct.
So aligners help to make your life comfortable. So are patient ready to pay
Spend
for
that
it
much
for their comfort? So if they are comfortable to pay, aligners are costlier compared to the brackets.
In general, I feel that dentistry is a very costly field, and we don't have much support from the insurance also coming. So somebody who has to get themselves properly treated, it's definitely a task, matter of concern. You know, they have to readjust their financial problem, stress, and everything. Why is insurance away from this particular field? Just because we don't have 24 hours admission, or there are other reasons towards it?
See, looking at this, if I want to make the cost equal or even, the government has to put a system protocol and make the cost even. So when that is not happening, that is impossible, which will not happen. So the dentist plays their cost based on their system and protocol. See, again, you go to a bench showroom. Okay, and you ask about the car, how much is it? And that's going to be an X amount. You go to a Maruti showroom. You go and ask about the car. But when I ask you how much is the car, you will ask me what is the car. So same way, the dentist protocols are different. When you ask me over the phone, how much is a root canal? Without knowing what system and a protocol which I am using for a root canal. If the dentist uses in a different protocol, they charge accordingly. So the charges is based on the system protocol, a sterilization, what we use it, and what best can be delivered to the patient. It can be done in a simpler way also, and it can be done in a more systematic way also. So the cost is based on that.
So infrastructure is playing a very important role. The type of machineries that are going into place that defines,
Exactly.
and that's exactly why insurance are not getting into this.
Insurance, yes. See, insurance are companies where they do a financial value transaction in the sense anything done with money. You can say insurance are like helping people at the time of stressful conditions and things like that. But it is always when money is involved, it is only business. I feel the insurance, where they can give insurance is wherever they get benefited. I feel the dental treatment is not benefiting them.
That is what you feel. There's absolutely no other reason.
No, thing is like I've for a long time, patient used to ask me whether the medical insurance covers dental insurance, and I've been talking to the medical insurance people, and they'll say dental insurance are not covered. And there is one good answer from a person said that the dental problems are everywhere. So every house has a dental problem. It's pretty difficult, and I was like, okay. So, which means when the problems are more, the insurance is difficult. So, every other insurance, medical insurance also is above age of 60. The cataract, you don't get the cataract done at the age of 30, 40 and all. It's above 60. Major of the problems happening after the age of 60. So, my concern is always when the dental comes, the populations are more. So, is it possible for the insurance company to give it to all? And is it awareness is there for the patient to take the insurance also? So I've never seen an ad for a dental insurance still.
Yeah.
But I've seen umpty number of ad for the medical insurance serving community people. So the question from my side is also this. The dental insurance is not happening. And it is not happening for many years now. If at all, if it is happening, when? When it is going to reach many people, where every house has 2 people as a patient with the dental issues. They can, a sudden problem, a week before, there is a kid who fell down and broke all her teeth, and it was to be splintered, and it was all immediate pressure to the parents. So sudden expenses, how do they cover? So this is what my question for the dental insurance company as well. So for the insurance company as well.
Do you really think the ticket size is the problem? Because, for example, if I'm coming for an implant, I think it's not going to cost anything more than 1,500 to 3,000 rupees. Or if I'm coming for a wisdom teeth removal, max to max, I'm going to spend 10 to 12 grand. Let's say 5-star class doctor. Do you think this is a concern that the ticket size is small? Like you said, they're not getting benefited because when you have a medical insurance, then you have obviously minimum billing value getting touched. Exactly. And out here, that's not the case. But this sudden occurrence of oral damage because of unforeseen circumstances, this is a very good point which they are not considering. And let's say something if there is an elderly person who needs complete change of the dentures, then it's definitely a costly expenditure. So are they selective or it's completely ruled out of dentistry itself? The insurance doesn't exist at all.
No, I've seen few companies have come out with dental insurance earlier. But in my 20 years practice, I have seen nobody claimed it. So people have asked for if it is work. I'll always ask the people to go check with your rep if the dental insurance is covered in clinic.
Hmm.
But I've never seen people coming up asking for insurance again because it didn't happen in my clinic at least. So preferably if they think that the amount is less where they cannot cover, once again, that's again I'm talking about it as a business ways where they think it is not benefited, then it is not working. So if they think it is a service or something which is not happening, but I'm saying the insurance company always sees what benefits them. And I would say even in COVID, when the quantity was so huge and they couldn't afford it,
Correct.
everyone knew
The
that.
demand and claim
The
were
demand,
so
the claim
much,
was so much
they were
they
not
couldn't
able to
afford
take it up.
So when there is a sudden crisis, then they are in a chaos as well. They have their own
Right.
problem, I can understand. But with dental insurance, is becoming a deal.
Next topic which I wanted to discuss with you is about Invisalign. Almost every doctor who is a dentist, they have this board in the clinic about this particular practice. Very renowned name in today's market it has become, and a lot of people are maybe experimenting with it or maybe advising it or also maybe practicing it. There are mixed opinions about how this works. As a dentist, what is your opinion on this?
See, Invisalign is a company and it gives you a product which gives you alignment and treats all the alignment issues, crowding issues, spacing issues. It's an alternate for a bracket. So basically, what brackets discomfort is, they have overcome all the drawbacks and they bought it in a more simplified way. And Invisalign is one of the pioneers in that.
Right.
They've been into the market more than 20 years right now. They've treated almost globally all around the world. So they have literally marked everything in this aligners world. So when patient drops into my clinic, when I see the problem, when I feel the bracket is going to take up so much of pressure and it's going to give patients so much of discomfort, my alternate product is always aligners. So Invisalign is one of the company which has been there into the market. So I have a trustworthy on that. There are Indian aligners which has come out beautifully now. That is a copy paste of this product. So now orthodontists have started to make their own aligners. So everything works. Everything works based on the issue. If the issue is very simple, I've gone with Indian aligners as well. If the issues are more, then I see the research paper of an Invisalign where they've treated it and I'll go with that. So the aligners worked with me based on the need of the patient. The same problem, patient is okay going with the brackets, I'm okay with it. But I always give an alternate to see the comfort of the patient and then work on. The pain factor is another issue where people prefer Invisalign than brackets.
My question out here is that, for example, I am a patient who comes to you, right? Now, not many doctors or many dentists are going to see in a way where they see whether they need it or not. Few of them just advise this at a very random basis. They maybe I may not require it, but from the business perspective, they do recommend it. And most of the patients today in Indian scenario blindly believe the doctors. I, as an individual, should I have a thought process here? Whether, okay, let me explore other options, because I'm certainly sure that not many people know that there is an alternative towards Invisalign. Like you have Indian version of it, which is the cut copy paste. What is the accuracy behind it? How a patient should react to this? Should the patient question? Should they get to know the more details? I'm pretty sure it's an expensive treatment at the end of the day.
See, basically, when they drop in with a problem, patient always have a Google check. They'll always come with a Google knowledge. It is not that patient are unaware about it. On the consultation table, the patient will always be clarified with all their doubts. So when they come with this aligners, brackets, or Indian aligners, whatever it is, it has to be shown to them. Based on that, they can choose it. All the products, especially on the bracket, has been there into the market for a very, very long time. So that requires orthodontist assistant every month, and it has to be tightened, and that is going to give them pressure. So Invisalign, it is going to be pain-free, and that has to be changed every 10 days, 12 days, and then that is a set based on their problem. So Invisalign makes the life really comfortable. And the Indian aligners is another other roadway where it is start to come up. Also an alternative for an Invisalign in India, purely based on the cost. Invisaligns are pretty costlier. So when Invisalign are costlier, then the Indian aligners goes along. The issue is like how many of those aligners have done the treatment universally. So that's a question where the dentist should know. And as per that, they should advise the patient based on it. The patient taking up their decision is what doctors' consult is all about. If the doctors make a decision and give two options, they can choose based on the cost alone at the end and the comfort. So the patient has a right to ask the doctor about their doubts and queries, and based on that, they can just, it's a product. See, the treatment there cannot
There cannot be a say
they
in it.
cannot have any say on the treatment part. But on the product what they choose, they always have a say. So they can ask them, if the bracket, what is the problem, and if the result is all the same, what is my child is going to do if the brackets are placed, what is an alternative, is there any Indian aligners possible? People know there is an Indian aligners possible, and they can, I've seen my patients asking about that also. So based on that, they take a call what their kid needs. Treatment, really they don't have a say, but on the product, yes, they can choose.
A lot of dentists have come up with their own brands when it comes to the aligners. Do you recommend going with somebody who is customized his or her own brand, or should we just go with the brand which is globally recognized?
See, I always suggest go with the globally recognized brand until you're very sure about your dentist. Because it is again a studying and a learning process.
Yeah, it's a lot of experiments going on.
Experiments going on. So this is under experimental process which is happening. Preferably in another 5 years time, we'll have a big brand here in India. So until then, I would always suggest go with the problem and the solution provided by the dentist. If the dentists are confident enough that their own brand can work,
Fair enough.
you can go ahead with that. It is all about the dentist giving the end result to the patient in a proper way.
And the patient having the trust on the dentist.
Exactly. So if in my clinic, in my practice, I always give an option and they'll pick one. And always the patient asks, what you choose? And I will say what I choose. They would go for it. This is how it worked in my clinic.
In the last few years, especially in the last, I guess from 2019 onwards, there has been this brand who says that we will come to your house, take the measurement, and give you a customized aligners. What job a dentist has to do is now being done by a person who's going to come to your house who is not who may not be a dentist also. He's just following the protocols given by that particular brand. Is it healthy enough is my first question. And second, how is this practice allowed, where there is no involvement of somebody who is from the field and just going with the machineries which are put into place?
Sure, I'll ask you one question. Okay. I'll come to your place and I'll say I'll do a treatment. What do you say?
I will obviously say no, because I don't have that setup in my house.
Exactly. That's the whole issue. If a cardiologist say, I'll come home and do your heart surgery there, will you allow it? See, basically the marketing tool is this. People are lazy and they want to capture them. Okay. Anything at their doorstep. Swiggy came up when people are lazy to go to their
restaurants and
have a time there. Zomato came up Gunzo came up. It is all people laziness what they captured it. Same this also. There is at home, just imagine the patient is lying in a bed and someone coming up and you do some treatment and how it's going to be. Then what's a need for a dental chair where tooth is very small? And the problem is smaller even than that. So it is like when when you had to see something, it has to be in a comfort level for the patient as well as for the doctors. Going and checking in the at home, I would say it is not even.
But how is it even approved is what my concern is,
No, it is
because
not approved at all. It is, see, basically when you go home, where it is approved is patient is physically challenged. When the patient is not able to move, then the doctors can go do some palliative treatment as an emergency care.
correct.
That is how home visit works. Not like technical aligners going into the team and sitting in a room and taking a scanner and doing treatments. That is not even
The accuracy was also challenged by a lot of people that it's not accurate. It's made no difference for a long time.
I would say it is ethically wrong and medically unfit. It is.
So you never recommend this kind
I
of
will
practice
not
at all?
recommend this act. It's not about gaining patient flow. I'm trying to say it is not recommended for general dental health as well. So keeping the area clean, mouth is a mirror of the body, where whatever we place it in the mouth, it should be under a very, very clean environment. That's why ambience come into play. So we spend a lot on the ambience just to make sure that the patients are served in a better way. So because the bacteria, I don't want them to carry any bacteria from the clinic. So this home visits are not entertained at any point.
How are they breaking the market where they are trying to, like we have D2C brands, it's somewhat in that segment. Me as a patient, I might be having alignment issues, but how are they trying to market in a way where, I directly approach them? That is something really, I am not in favor of. How will I realize that I'm supposed to go to this particular brand and they come to my house and do the needful? My first thought process has to be I am supposed to go to a dentist. But still there are people who try to get this sorted and then they come out of it and they're like, no, it didn't really work out. And plus it's also expensive.
So see, basically one is a cost factor. They promote in a way that it is very cheaper and it is at your doorstep. So both are comfortable for the patient. That's all eye-catchy. So once they get it done, they don't have to talk to anyone. It's just like you finish it, oh, my treatment is done in this way. They come and get it done. And once first align is when they place it and they feel it is not fitting. When they don't get proper response, then I've seen patient coming up the same way.
Correct.
I've seen patient coming up, getting the treatment done. It's always a double cost. So coming home and doing a dental procedure, except for a physically challenged and an old patient where they're not able to move, giving them the palliative care, anything else doesn't work. At home, definitely no treatment.
So it's a definite no for this kind of treatment.
Exactly. At home, these type of aligners where patients are getting trapped, I would always say they are getting trapped on the flashy
And catchy
ideas.
ads. Today's time, especially the Gen Z kids, because there's a lot of celebrity videos that come out, and many of them have spoken about teeth whitening, and there are several brands which says that this is the device, you just put it here for 15 minutes and your teeth turns white, so you don't have to go to a dentist. Teeth whitening is something which is very handy in today's time. A lot of them don't prefer going to dentists. They try all these lucrative methods to make their teeth look more white. Number one is that why is it become a fashion sense? It's supposed to be the other way. You have to look from a oral health perspective more than fashion. But most of them are now seeing it as a fashion appeal. From your eyes, especially, since more than 2 decades in this profession, does it pain you when something like this happens and somebody comes and as a patient, somebody might have come and told you that I tried this and it didn't work out?
No, many a times patient have come this way. They would have used some product and they'll come and say it isn't working. But for me, it is like how the patient's getting convinced to use that product without knowing the ingredients. Earlier, we discussed about the sodium lauryl sulfate in a paste. But these whitening products, whenever we
Nobody
use,
cares.
nobody cares. That is a bigger product, bigger solution, bigger ingredients inside to change the tooth color. You should have few chemicals inside, right? When we do it in a clinic, it is have a recommended amount where we place a whitening. Even we say it goes in shades, it will not show any big difference. It goes gradually. But certain products, yes, which is available in the market, it's just like a facialing. Suddenly, it will give you a good appearance, and you go with that and finally finish it. And what that happens is like I've seen people complaining of post sensitivity issues as well using these products. So, until and unless dentists recommend one, I would always say just do not use anything on your own. It's just like shopping the dental products and using it, and tooth is all live. Treating the tooth after sensitivity, after applying the whitening agent with sensitivity is much more difficult. So address the doctor first if you want to get the whitening done and see if the whitening is really required. At times, a simple cleaning will give them benefits.
Better results.
Better results. So just go to the doctor. See, if you go for a party, then you go for a facialing. So you don't apply anything on your own at home, right?
So self-medication is definitely harmful
definitely
here.
Contraindicated.
People are taking it in a very light way, considering it's only teeth, but self-medication is definitely dangerous.
Exactly. So even if people are working on the pace more, right now they know the ingredients, but it's only the flashy ideas and thoughts and the marketing strategy of a company which is promoting or making them to do it. And at the end point, it is always a tooth which is suffering. So the sensitivity portion I'm talking about, at times patient come with gum lacerations, the gums start to burn a little. This is all I've seen using the products which is marketed
And available online.
So whenever there are beautifully done treatment in clinic with the recommended products, it might look costlier, but the result is long lasting
and also safe. That is most important.
Yeah, it's safe. It's very safe. When it comes under dentist hand, it's always safe.
Earlier, personality development was more about fitness, improving your talking skills, your appearance, the way you carry yourself. All this used to be one of the pointers. Today, smile correction has become one of the aspect towards, personality development as well as the personal growth, confidence and everything. And I know the fact that you believe that very strongly. You as a dentist, when you do this smile correction, what exactly you do and what exactly is the process that goes into it, and which type of people come and approach towards this smile correction technique?
See, I'll give you an example with my patient. Post-COVID, there was one patient who dropped in. Her age is 64. Yeah, 64. She wanted to get the smile correction done. The post-COVID is one thing which I don't want to touch the tooth at all for a smile correction. But the lady was saying that my husband expired. I wanted to correct the smile. I don't know when God is going to take me. Before that, I want to have my smile corrected. And literally, she forced me to do the smile correction. And it was really good, and she's running so good right now. So the smile correction has no age. I've done from 18 to 70. So in a minimal way, with 2 teeth also, with 3 teeth, with 4 teeth. It is always that smile correction. It doesn't mean that I am going to correct the entire set of teeth in the front. Even 2 teeth at times it makes a...
What exactly happens? How does dentistry help in correcting the smile and making you look more confident as a person?
The people will need a mild alignment changes. Then I give them the suggestion to close those alignment and gaps so that they look better. The smile correction is not only trimming the tooth, putting a crown on top of it. It is alignment is also one of the smile correction.
Okay.
So when I feel when the patient, the alignment is going to take at least 1.5 years. When the demand needs that the patient wants it immediate, then I see another alternate option. How could I correct it? So there comes the 3D smile design. I take the photograph of the patient, I take the scan and a model and design the smile of the patient in a 3D way, both on the sideways, straight smile, everywhere. Then I put into the patient's mouth as a temporary mock-up and show them. Whatever corrections they wanted, we'll correct it and we make the smile design that way, putting into a material what is best for them. So the smile correction basically based on the need of the patient, and I give option based on their demand.
So this is something, for example, I will come to know what my end result is during the research stage itself.
Research stage itself. You know what.
So
are
I'll
you
know
going
how
to get.
my smile is going
Exactly.
to look after the final treatment.
Yeah, that's what. There is no curiosity at the end whether, okay, after fixing it, oh my God, my smile is not looking it. No way.
So
At
you're
the initial
well,
stage,
okay.
you will know what is your smile is. And from there, you will proceed.
And how expensive it is?
It is expensive.
It is very expensive, you mean?
Say anything to change your smile and it is making you confident, you had to.
The
really
cost
put it.
depends on number of corrections that needs to
Exactly.
be done.
See, it starts even with 2 teeth. I've done smile corrections even with 2 teeth. I've done with 4 teeth. I've done with 6 teeth, 8 teeth also. I've done with full mouth also. So the demand and whatever the patient demands and the problem demands. See, sometimes patient doesn't come with the smile need itself. But patient has so much of functional problem that I had to correct the smile.
Correct.
So they get smile correction free of cost. Even then, I'm correcting it in a functional way.
But how do you diagnose that he or she actually needs a smile correction? I'm talking from perspective where, for example, I have a smile, I may not find it good enough, but you may like it. There could be such cases also. So it's more to do with the mental aspect. So how do you judge? I mean, evidently, you need, that's a different story. But somebody who is not happy with the smile from a mental perspective and they come to you, do you still do it?
See, when patient comes to me and say, I don't like the smile, I'll ask them why. See, the smile is one thing, irrespective of anything, I want people to show their teeth and smile louder. So that's my aim. That's why I started to work on the smile design.
Right.
So my first question will be, when you take a selfie, my first question to the patient, always when patient dropped in, when you take a selfie, do you show your teeth and smile or you don't show it? When they say I'm not showing it, then I'll see the confidence level is little less for the patient, then I'll try to help them. I might like her smile. I might like a grandmother smile even without the tooth. I might like a baby smile. So my vision on smile is different. So, but when patient asks me, I decide what their need is. If it's ethically possible, I'll do it.
Okay.
For that, investigations are huge. As I told you, I'll take a photograph on all sides, and I have a team who's good enough to take all this, and we take a scan. We do a 3D design of the patients and see how it's going to look, and put it in patient's mouth and see. The patient will decide, oh my God, this tooth is looking better than what I have, or my original teeth is good. If they feel that the original teeth is good, they'll be very happy, and from their confidence level goes up. Oh my God, my tooth is designed. Because whatever I'm doing it here, even in you go to US or UK, whatever dentist does for the smile design here, you go elsewhere, the way what we are doing it. So the protocol is going to be the same. Here and there, if they want, okay, if they like the design which I'm going to give them, if they like the smile so much, then I change the smile according to it by putting the materials what they.
And how long is the process?
It's max 20 days.
20 days. In 20 days, you can change entirely.
Entirely.
And this cannot be reversed.
Exactly.
It's
it
done
can
is
be
done.
reversed, but it is pretty difficult.
Pretty difficult.
Okay, see, that's why this temporary comes into play. I've seen patients nodding for a temporary and complaining on the permanent also.
So do you guys get that document signed?
Exactly. So you need to get the consent form
Yeah.
that you're okay with this. You're going to get the end result the same way.
What is the frequency of patients you get for smile corrections, let's say in 1 year?
No, I'll say per month, at least for a consult, they'll come 4 to 5 patients.
4 to 5 patients.
Yeah, consult.
But that's definitely
But
a huge
treatment-
number, right? As far as
I'm saying other clinics might do more than this also. Okay, because it is about how much you promote it.
Okay.
See, when a patient comes in and you say your smile is not good, okay, come on, let's. I never promote that way. When patient asks for, I go for it.
But do they get influenced this way? Somebody's
Many a times they
randomly-
influence, they
Okay.
get influenced. That's the problem. The whole lot issue is all about when they get influenced and dropped in, then I'll always have a second check. But if I'm not doing it, there is always another dentist who's going to do
Who's
that.
gonna do it? As simple as that.
So it's only, see, the kids right now is always want the most symmetrical way of smiling. They should also understand that asymmetrical is also good. I'm saying a grandmother without the tooth will also look good. A baby without the tooth, you'll love to see. So if you understand that, your thought process has to change on the smile design.
Correct.
If it is really bad, then we'll think about it. But if the smile is good and you want to enhance it, I go with the need of the patient.
One important aspect in oral hygiene today is about mouthwash and mouth sprays. So something which was supposed to do a job of taking care of oral hygiene is now used as a supplement, or I would say instead of brushing the teeth, they use all these things just to see. A lot of people in India are thinking that brushing the teeth is not about cleaning teeth, it's about the bad smell and the odor not coming out. So they tend to use mouth sprays and mouthwash. As a dentist, what is your take on it? If somebody is using it, how often they are supposed to? Because a lot of people have got various perspectives. A lot of dentists believe that you're not supposed to use it. Few of them are like, maybe every second day in the night after you finish your night brushing, you can. On a longer stage, it's quite harmful is what people believe.
See, basically people using mouthwash, mostly about 80% of the people, they'll always have a bad breath. So without curing the cause, you keep using mouthwash, again it is a very temporary relief.
Again, curing the symptom, not the cause.
Yeah, once until you eradicate the cause completely, the problem is going to occur again and again. So the mouthwash use can be very, very limited. And to be very honest, I never use mouthwash. So it is not necessarily that you need to use a mouthwash. A gargling will help if the tooth and the gums are clean.
Clean.
So what matters is not the sprays or the mouthwash which I'm going to use it. Again, if there is an inner issue which has to be treated, without treating it externally, you put anything, it's not going to solve the problem.
And what generates bad breath when it comes to oral hygiene? What are the causes which makes it happen?
See, the most common problem is the dirt which is getting collected between the tooth and the gums. So when it is neglected for a very long time, I'm talking about the most educated people neglecting it for a very longer time. People who smokes, drinks, and have so much of junk foods. People with cavities where it is not treated, where the food particles goes and lodges there. When they have a gum inflammation. So from there, the problem starts. You start to develop all bad smell. The point is, even when you have a stomach issue, acidity issue, the reflex also will give you bad breath.
Not necessarily it is just because of oral hygiene.
Oral
It could
hygiene.
be other aspects also.
Aspect also. So when the issues like, do not self-medicate it by using a mouthwash, seeing an ad, okay, bad breath, put a mouthwash and things will go. Underlying cause has to be removed so that you don't have to use mouthwash. You can just get away with simple brushing, gargling with water. Your job will be done. Your life is so easier instead of using so many tools inside your mouth. So basically, I would prefer
It's an
to treat the
optional
cause.
thing is what you suggest.
It's a very optional thing.
It's not needed, but okay, if somebody wants to use it, they can.
Yeah, if everything is good, if they want to use it, yes.
But what is the purpose of it? Because we never had something like mouthwash, long time back, and suddenly we have it. Mouth spray, at least I can understand that you may eat something.
These
And
mouthwashes are used when there is a gum inflammation. I'm saying it is a very temporary and a recommended dosage of use. It is not like you can use it for lifetime.
okay,
I'm just saying if you do a brushing, I'm saying me being a dentist, I'm saying I've never used a mouthwash. I've been brushing my tooth morning and night, and I gargle my tooth every day. Every time, whatever I put inside my mouth, I gargle my tooth. I drink lots of water. That's it.
That's it.
So a healthy lifestyle matters more than using all these tools. It's all look so flashy again, but you can be very free from all this product and lead a very good oral cavity.
As much as possible, we shouldn't be, in favor of all these products.
Exactly. As much as possible. Get away with all these chemicals so that use your own brushing habits and a lifestyle to keep your oral cavity clean, and that will help you to build your health much better.
Much better. Traditional brushing versus modern day brushing. A lot of, ancestors, our grandmothers and grandfathers used to use these neem sticks, which was known to be the best way to keep oral hygiene good. Today, it's being still practiced, but not much spoken about. And I have not seen any dentist discussing much about it. And what is your thoughts?
See, when I grew up, even my grandmother was using brush. I've never seen my grandmother using neem stick, and they had a very good teeth. See, my concern is all about whatever you use it inside your mouth, it has to be clean. Okay, and you should get that continuously, constantly. So the neem sticks are something where it is generally you cannot make it clean. Are you going to get it, or it is recommended by a dental council?
No.
So something which is not recommended and something where I'm not aware about it, and something which I've not seen result in any people, then I don't have to think about it much. If something is benefiting you, why do I want to change to something else which is going to benefit, which I'm not know? So my grandmother would have used it, my great grandmother would have used it, but right now I'm not using it. And for me, brushing is
Making more
make
sense.
more sense. So what I'll do is I'll continue my own brushing. So what I suggest is what I'm using it. Suppose I'm not going to use a neem stick, and if I'm saying, okay, neem stick is very good, continue using it, then it is a foul play. So I don't want to do that foul play. Whatever I'm using it, whatever I want to give my kids, I want to give my patient also. So
Makes sense.
all this is all recommended. I've seen it through my kids where they start using it. So brushing is always via brush and paste, and that's more than sufficient. You don't have to break your brain so much how to keep the oral cavity clean. Instead, I always see, mind your food when you're eating it. Okay, instead of after eating it, whatever you want to brush is a different story. But if you mind your eating, and trust me, that is going to serve your teeth in a better way. So after eating, you please do gargle. So that is going to keep your tooth very, very clean.
Very clean. Dental hospital versus dental clinic. What's your ideal choice and why?
See, now in dental hospitals or in a dental clinic, the equipments and everything is all the same. Infrastructure is a difference. I've seen what you can do in dental hospital extra is treat the patient under general anesthesia. Okay, you can put immediately in a patient who's in need of a general anesthesia, we can put it inside and we can treat the patient. That's a little more a sophisticated way of handling it. But the treatment protocol, I've seen a single chair practitioner with a great knowledge serve the best than a big dental hospital with no knowledge.
Clinics are more recommended, more suggested is what you feel.
Yeah, that's it. So it's not about...
Individual attention can be given better?
Yeah, exactly. So the dental clinics again, the ambience come into play. The dental clinics works in a very small area. Hospital works in a square feet. And with more facilities inside, like this hospitalization, in-house substances which we use for dentistry. So it is not a big difference as far as the skill is concerned. Armamentarium, yes.
Okay. What is a message that you want to give to the aspiring dentists who are right now in college and who are aspiring to open their own clinic?
Doing dentistry is pretty easier right now. studying and coming up is even more comfortable in today's scenario. But surviving in dentistry, you need so much of knowledge and skill.
Skills.
So every day there is a dental problem which is coming up new. You had to keep on getting updated on the issue. So dentistry is not only money. Behind the money, there is so much of hard work which is running around. So when you see patient and their treatment comes first and then the money. So you can survive only when you deliver the best. So you need to constantly acquire knowledge, keep yourself updated, and work on your passion and keep moving on. It is a constant and a very continuous learning which you need to keep learning. There is no end for it. So the dentistry is harder, but it is one of the most lovable profession which I keep going on.
Rightly said. I think we had a beautiful conversation today, a lot of insights and tips that I was able to get out from you. And thank you very much for joining the podcast. And I'm pretty sure the audience are going to enjoy it. And obviously, few eyeballs are going to be up hearing this podcast in terms of few information that you have shared. And I wish you the best. And we do this again in time to come. Thanks a lot.
Thank you, Shivashish. I'm very happy to be part of your show. So nice to be here, and I'm very happy to see you growing in a big way. Thank you.
Thank
you
you.
so much.
Thank you.